One of the things that I am truly honored and humbled by.
There was a time when Ronnie Grace avoided the camera.
The first time I moved to Los Angeles and I went to a gay pride event, and I was mortified when I saw cameras coming toward me. And I just froze, because of the stigma. Who's going to see it? Who will see it who doesn't know that I'm gay?
That fear and self-loathing was taught at an early age.
When I was a kid, I was called different names, and I didn't understand because where they came from. I knew I felt different than a lot of other kids, and so I went into the dictionary and then into the encyclopedia, and there was this one line that said about homosexuality, saying that homosexuality is a sickness, it's an illness. And so I took that with me, that there was something wrong with me.
But things have changed. Now 2 cameras are fixed on him as he slowly spells out his name.
My first name is Ronnie, Ronnie. Last name is Grace, Grace.
To make sure we identify him correctly.
And now, I can bring my whole self into a situation, bring my whole self into any doors that I walk through. Whereas there was a time where I wanted to hide my identity because of all the stigma that exists in the world.
And it's that stigma that continues to harm the LGBTQ plus community.
These stories reveal a larger tapestry of our collective past.
Which is why stories like those featured in Wisconsin Pride, where gay and queer trailblazers are put on a pedestal, are so important.
We are not born more sick than our heterosexual peers. But the disparities that plague the LGBTQ community comes from somewhere, and I believe it's with stigma as the main proprietor. I think that it's important to again validate those experiences of people, so that we can continue to create the world that we want, that we would all feel comfortable in. I think that's really what fuels the work that I do.
The work that both Justin and Ronnie do at Black and Brown-led organization Diverse and Resilient is a literal lifeline for many in the LGBTQ plus community, and worth a closer look.
Welcome to Diverse and Resilient. I'm Justin Roby, the Director of Prevention, Care, and Empowerment Services. Our mission is to achieve health equity and safety for all lesbian, gay, bisexual, and transgender individuals here in Wisconsin. And we work every day to achieve that through the work that we do. And welcome to our Anti-Violence Program Office. This is where we refer people who have experienced violence within their communities, within their homes, within their schools, and they're reaching out to get services and resources from us. We're here in our Community Programs Department. Here we host our sexual and reproductive health teachers, so the ones who go out into the classrooms and do the curriculum. We, again, partner with NPS and other local schools to go in and do the instructions of making pro-choices with a specific queer focus, making sure that we really highlight the expansiveness of sexuality and allow for the students to ask those deep and intimate questions with our staff. So we're talking to young folks about what makes them feel good, right? We have to be okay in the discomfort that comes around that conversation and the commitment to grow from there. But avoiding the conversation we see is not the answer. It does not produce anything but negative health outcomes. So if we really do love the people who we are talking about, it is our duty to be uncomfortable and have that difficult conversation and provide them with the resources that will give them the best outcomes. And now here we welcome to our counseling, testing, and referral department, where we do sexual and reproductive health testing. We do rapid HIV and syphilis testing. We have holistic sexual screenings where we partner with Holton Street Clinic, where they provide a nurse on Tuesdays and Wednesdays from 12 to 3 for holistic sexual health screenings. We do offer appointments, but we offer walk-in as well. We do referrals for PrEP, so that's the pre-exposure prophylaxis, and PEP, that's the post-exposure prophylaxis, as those things have come up, as well as resources to like Pathfinders, the Benedict Center, and other local resources that could benefit people from our community and people that we trust. So we vet resources in this particular department and make sure that we're giving them out on a regular basis. We have late night clinics every second Thursday from 4 to 8 p.m. The second Wednesday of the month, we are at This Is It, This Is It is one of Milwaukee's oldest gay bars, but oftentimes coming down here to be tested is a barrier because again, they're stigmatized by just the identity that we have at the front door. So getting out and into community in spaces where we know that they frequent allows for us to be able to reach them at their level and give them and serve them with dignity, because sexual and reproductive health is beyond just whether or not a person's HIV status. So knowing your status is not enough. What do we do next? How do we engage in those optimal health outcomes? This is how we help to proceed that moving forward, by giving those holistic options and treating people with dignity. And this is our community space, one of our conference rooms prominently held for our Sheba and Biba programming. Sheba stands for Sisters Helping Each Other Battle Adversity. Biba, which is newer, Brothers Helping Each Other Battle Adversity. Ronnie Grace, one of our longtime and founders of most of our programming, used to be the facilitator for Sheba. And this is, of course, him with one of our long-term Sheba participants. We actually brought her on to staff, and so she gets to serve as a testament of what can happen. As a former drug-impacted user, she now is clean and sober and able to do this type of work. She's gone back to graduate from school, so continues to be a pillar within the community, especially giving voice and power and advocacy for her Sisters of Sheba. So again, going back to say, I've done this, I know other women who could benefit from this, can we do this as an agency? So when we talk about the empowerment that happens, that's the goal, right? To go from a person who was passed over for opportunities years ago, but now is sitting at the forefront, feeling empowered and able to make space for other people. So this is our Libations Lounge. As you can see, this is the hub for a lot of our community programs. In this space, again, we do also host the youth group as well. So again, they start at the garden side of the space. And then our care program. So for people living with HIV, we have the peer navigation program.
We define ourselves as a society by the stories we tell.
The Wisconsin Pride documentary offered an important look back at the people and organizations who have advocated for the LGBTQ+ community.
My mission in this work is to meet every young Black and brown queer individual in this city.
And if we were to look forward, as our state motto demands, you can be sure that Diverse and Resilient will be there, playing a vital role.
Diverse and Resilient has already positioned itself as one of the few Black-led orgs in the state as an example of what it means to invest within the community that you truly serve. Having leadership that reflects the community that you intend to impact changes the decisions that you make in those rooms of power. And so the way that we are going to grow as an organization moving forward will be completely different than what we have in the past. But it will be different in a way that we can understand the impact and the real lived experiences of the people who walk through our doors. This unique growth under Black leadership will suit us to, again, be ready to end this epidemic, because I see the end in near.